Hello, and thanks for listening to the MiCare Champion Cast. In February, Change Healthcare, a subsidiary of United Health Group, was victim to one of the most significant and consequential cyber attacks on the U.S. healthcare system. As a result, patients have struggled to get timely access to care, and billions of dollars have stopped flowing to providers, which in turn threatens the financial viability of our hospitals, health systems, physician offices, and many others. In response to this, the MHA has been in close contact with the American Hospital Association, the Michigan Healthcare Security Operations Center, and other partners to stay up to date on how this is impacting our members. We strongly encourage hospitals and healthcare organizations of all sizes to consider CyberForce Q, an MHA-endorsed business partner, to help assess, enhance, and maintain your cybersecurity operations. In today's episode, we're going to give listeners a closer look at what happens when a hospital or health system experiences a cyber threat and what steps can improve digital security. Joining me virtually, I have Jack Kufahl, Chief Information Security Officer at Michigan Medicine. Jack has over 20 years of experience in information technology and leadership and is one of the incorporating officers and board members of the Michigan Healthcare Cybersecurity Council. In his role at Michigan Medicine, Jack is responsible for planning, developing, implementing, and maintaining information assurance activities across the academic medical center. Jack, welcome to the MiCare Champion Cast.
Thank you very much for having me.
Well, I can't think of a topic that's more foreign to me than IT and cybersecurity, so I'm excited to learn a lot from you today. And I did get a chance to speak to you before the record, but if you can just start by telling our listeners a little bit more about your role and background. And I am genuinely curious, what led you to cybersecurity and IT, and how did you end up at Michigan Medicine?
I actually have a more than 2-decade history at Michigan Medicine. So I've done many different types of desktop support, to system administration, to leadership, on the clinical research side. And that led the first Michigan Medicine Chief Information Security Officer. So in a lot of ways, I came to information security in an atypical path. But I think that's helped me have a perspective that works for both the learning, research, and clinical mission here.
Right. Yeah, absolutely. And I think something that's interesting when we initially talked was we're both storytellers, just in a different way. We're both breaking down really complex information and telling a story through the things that we're working on. So I think most people are familiar with the latest on what's happened with Change Healthcare. We gave a little bit of background in the introduction, but can you share what your reaction was from the university health system perspective and any updates that you have since the initial attack in February?
Sure. Change Healthcare initially presented itself to me as just another what we'll call third-party cybersecurity issue. So hospitals, and I'm sure many other sectors, but hospitals in particular, in my opinion, use many third parties to help them do clinical work, administrative work, productivity work. And probably in the past 5 years, I've seen an uptick in that. There's a huge market for third parties to help hospitals out in a number of ways. So we're consuming those services, which means when a third party company has a breach, we have to be tuned and understand it. Mm-hmm. Initially, I didn't really have the context for how that affected us. And it was in the following day. I learned about it in the evening. And then the following day, we really started to understand much more of the context and started to scope what the impact was, which for us was significant.
Right.
It affected the way that we were doing our revenue cycle, our billing. We were using an e-prescribe function from that company. So we had both operational, administrative, financial impacts, but also clinical delivery impacts as it applies to expectations with e-prescribe. Mm-hmm. So there's quite a bit of trying to understand just what was going on at MichMed and then broader inside our community. And it came into focus probably over 2 or 3 days where we broadly understood what was going on, and having that immediate feedback and engagement from Change, Optum, United Health Group was actually very beneficial. One thing I could say positive about the event was our initial communication and the engagement from United Health was very positive. I would say they had a good model for how to engage, how to communicate as they were working the problem themselves. And that's the type of engagement that as a CISO, we wanted to see. Terrible event, and they're still determining what exactly happened and what can be disclosed. It's a very slow process.
Right.
We've experienced that process. I'm very respectful when companies have that, and it's a little bit disruptive when there's other news and reporting, either not from United Health or not from a law enforcement agency or a partnership, disclosing what's going on. And that causes a lot of conversation and stress in the organization where you're trying to parse between what is official from, say, FBI, CISA, or United Health versus what might be getting reported on. And
right.
even as recent as yesterday, we're still having conversations with some of the impacts on the purported ransomware that's going on.
Right. Yeah. And given your expertise and position at Michigan Medicine, can you just walk us through, I know it's a long process, like you said, but walk us through what's happening behind the scenes in those initial days of finding out that there's been a cyber attack. What are you doing on your team? And, you can speak to it from this instance, or you could just share, from the local or national standpoint, what happens when there's a cybersecurity threat? What are you doing? What actions are happening? What's the process?
When it's something for like a third party like this,
Mm-hmm.
The first question is, from this company, what products are we using and what processes are we dependent on them for? So it's more of a resiliency, a business continuity question is, okay, we know perhaps we have a contract with a company. United Health Group's a little bit different because it's so huge and it affects so many hospitals, but any given third party.
Right.
The first question is, just because a company's been impacted doesn't mean we're impacted.
Mm-hmm.
How do we understand where that scope is? So it's all what's in the contract, what are the terms and conditions, what products are we using from that company, and inside healthcare, which is a multipolar environment, there's some sleuthing to do about, okay, but what are those impacts? Because there isn't any one person you can talk to, say, what are the impacts of this? You have to, in this case, you have to talk to pharmacy, you have to talk to operations, you have to talk to rev cycle, you have to talk to IT and help lace that together.
Mm-hmm.
And back to that being the storyteller, that's a really important capability for a CISO because you're taking all these disparate pieces of information and trying to knit them together so you can be a resource to the organization to explain what has occurred, how has it affected us, what are the next short-term steps, and what are some of the probably long-term steps. But then all starts with first scoping, well, what's the impact? Because third-party cybersecurity events are happening probably every day. But few of them will have a dramatic operational impact. It so happened that the Change Health one not only had dramatic impact for local healthcare organizations, but nationwide. So it got a lot of press and it got a lot of visibility. But whether it's a small company or a very, very large company, it starts with that scoping and figuring out the impact, which is not dissimilar from what we do any internal cybersecurity event is. Cybersecurity event has occurred. What's the impact, right? First, seek to understand what is going on so you can react to it with the appropriate resource.
Right. And if you were to react as you were getting information and communicating, just to explain when it takes a while, and you mentioned that there can be stress and panic involved from the people who don't know what's going on, there's a very good reason that there isn't information shared right away because you're gathering all that data from all the different parties that have been affected. And I think it's worth noting that it probably, I would guess, if you were to give every update as you were getting it and how it affected the different areas, it would actually probably cause more panic and stress because people wouldn't understand the full picture. And when you have it more of as a cohesive message, it probably helps people understand it a lot easier versus, constant updates about every step you're taking on the cybersecurity side.
A lot of times you have to resist guessing as much as possible. Because if you get bad information out there or you make assumptions about that information, that could cause more damage or actually outsized damage. So you could overreact, you could underreact. Inside a cybersecurity event, the things that I focus mostly on is not necessarily what tools and people we have to respond to contain and eliminate the threat. Most of my attention focuses on how do we communicate, how do we relate, how do we tell that story, how do we get the resources we need? How do we understand the context? So understanding the context of risk is related, but significantly different than just understanding what cybersecurity thing has occurred.
Right. Absolutely. And on the communication side, what do you find works and what doesn't in terms of just communicating internally? Do you have like a system that you follow or steps that you follow? Is there, protocol in place that everyone's kind of aware of that you kind of fire drill throughout the year? Or how did you come up with a process and what works and what doesn't?
So at our institution, we have I would say, really strong and appropriate command center structure with different layers and steps that help if you were to have a facilities emergency, if you're having a public safety emergency, and also an IT emergency. Inside our centralized IT department, there's layers of steps that can lead up to, say, activating the command center that are well practiced here, both in tabletops or testing, but also just everyday experience. So there's these different triggers and thresholds for each step of this escalation process that we depend upon. So from a cybersecurity point of view, we integrate into the IT workflow, which then integrates into the hospital command structure workflow. And that works well in experiment. Where the discord comes from is being the person to actually start that process. So conversations are occurring all day, every day. There's cybersecurity stuff all day, every day. And knowing where the right threshold is to activate the start of that escalation path is something that I think humans are naturally resistant to because they don't want to cause panic if they're wrong.
Right.
And I would say my recommendation is, have a system in place that allows for generous use of starting the escalation path with triggers and thresholds about how you address it.
Right.
Because cybersecurity does not need to go to a hospital command center. But you never know when something is going to take off, so you want to be well practiced in that.
Right.
And it's just human nature to not want to over-escalate, and in some cases, expected to over-escalate. We receive that. So a big piece of this feedback and a big piece of this conversation is having an ongoing conversation with your hospital leadership on what's expected, what your opinion is, and to put a couple of nickels through that machine to say, well, in this situation, should we have done A? Should we have done B? And to practice.
Right.
So in this Change Health sort of scenario, we definitely, even though it was a third party, and it didn't have servers or systems or computers or data centers that we really would impact, we did follow some of our initial, what we'll call our major incident process in IT, so that we could coordinate communication with a broad group. It didn't, however, escalate into a hospital command structure situation because we had the appropriate levels of communication and buy-in and coordination support. So it takes layers, and it takes practice, and it takes a willingness to engage with it as affirmatively as possible. And that tends to be the spot is when does a conversation with legal or your boss or a system administrator inform starting an incident? And I tend to lean on be very liberal with that. Don't be afraid to start an incident because we understand where those triggers and thresholds are to get into the right place in the organization.
Right. Absolutely. And I led into the conversation, I mentioned Cyberforce Q. How do you utilize partnerships with external, organizations? And I think you do work with Cyberforce Q. How do partnerships like that help you operate in what you do?
So Cyberforce Q is one of our primary managed service security providers. And they provide a number of services, but they are our 24/7 initial, what we call a security operations center. So they act as a filtering and early analysis group to try to find the signal in the noise. Because there are literally millions and millions of pieces of data that hit our protection systems. And we need to find which ones are riskiest, which ones are worth investing further investigation, which ones are pointing out where there may be a problem with our protections. And so the security operations center that Cyberforce Q provides us is first and foremost that triaging, that routing, and then that early analysis, 24/7, 365. Really nice to have. The added benefit of the model that Cyberforce Q follows with their security operations is it's collaborative. So there are many other hospitals sharing information in a very advantageous, just-in-time sort of way. Hospitals and patients and our healthcare systems are very intertwined, but our security protections are not. And when you have elements and partners like Cyberforce Q, they help add a layer of coordination. So an event that is happening at a hospital across town, even if it isn't being picked up by Michigan Medicine Systems or it hasn't hit us, is important context to understand what could impact us, but also have early warning systems and even some assistance that we can help reduce the impacts of those threats. And that partnership we have with that company brings those two elements together. From a self-serving point of view, you're my 24/7 triaging, so we can sleep at night.
Right.
The value add is how they coordinate across their sector partners, and that adds a force multiplier to how we do our work.
Right. I was going to ask how you are able to communicate with other hospitals and health systems, or if that's something that is leaned on when there is an attack this large. You want to talk to partners in the industry, I'm sure, to see what they're doing. So to have that bridge of communication, I think, is probably very important.
It is really important not to be alone in cybersecurity and healthcare.
Yeah.
And I will say over the past 8 years, the tone and temperature of collaborating across companies has dramatically improved. It still has a long way to go, but where there was very few examples, now there are multiple ones, where not just CISOs can connect with each other, but our teams can. And that is the most meaningful fabric that we can help reinforce. And it doesn't happen overnight. It happens with years of relationships and partnership and sharing the same foxhole, if you will. And it's important that regardless of if you're a big healthcare institution, if you're a small healthcare institution, that if you don't have those networks, either through a third party like CyberFirstQ, or there's another organization that we partner with called the Michigan Healthcare Cybersecurity Council, which brings together about, I think, 25 to 30 hospitals right now, just in a community to share. And that was instrumental with change, because we were all getting slightly different information. And when we aggregated that, we all got a much better picture of what was going on.
Right.
And we were able to spin up separate conference calls. We were able to share information. We were able to share our remediation tactics. Like each CISO was doing something a little bit different, and that's fine. But you want to know what other companies are doing to calibrate whether what you're doing is appropriate for your institution. So any one that is not part of a collaborative really should prioritize that, because it brings together a willing cohort to share information and provide advice, which is essential to keep up with these threats.
Right. To congregate information and tell a story about what's happening at one health system, one large health system at that, is one thing, but to tell the story and congregate information for a nationwide cyber threat, I assume, is a lot more involved. So I appreciate you mentioning collaboration as being a huge part of what you do. To go to the viability piece, we obviously know that there was a financial implication of the attack. Can you elaborate on how that affects hospitals and health systems? Obviously, we know it affects operations for the different offices, physicians' offices, community health centers. It affects a lot of different areas. What is happening on the financial side?
Funds flow and billing is not necessarily my strong suit. So a lot of what I understand about it is secondhand. But what I can tell you through those collaborative networks and through the national reporting is that the funds flow and the ability to bill was one of the most impactful elements of the Change Health situation. Depending on your organization's billing throughput, it could affect somebody, it could affect an organization profoundly, or it could affect them less profoundly. But there was nobody that wasn't affected by that was using those products. So in our situation, we were heavily dependent and are heavily dependent on those products. And it affected us. And I think we also saw smaller organizations across the nation really be in a more dire situation, where we saw United Health actually come out with different loan programs to help keep the lights on, if you will.
Yep.
And a lot of times I think people look at hospitals as really, really complex financial organizations and care organizations, which is true. But some of the most complicated work that I've been exposed to over the past 20 years has been billing, funds flow, not just the regulations that are involved, but actually the accounting and the staffing and technology requirements inside that space. So if you are, and we were, heavily dependent on a third party to facilitate that, those impacts are deep and significant. every hospital took a slightly different remediation, short-term or long-term remediation approach. But it took several days, sometimes weeks, to figure out what those are, because those billing systems and payer systems really are deeply embedded. It's not like trying to switch out an inconsequential piece of technology. It's in the firmament of an organization. And one thing that is terrible but interesting about cybersecurity is it really forces organizations through these events to evaluate where they are and where they are not resilient, and start driving the question forward about where do we want to be proactively resilient about that. Is it appropriate for, a 40-bed hospital to have a single clearinghouse? Is it appropriate for a 400-bed hospital to have a single clearinghouse? Is it appropriate for a 4,000-bed hospital to have a single clearinghouse? And your culture, your tone, your resources will change that. But what's important is that you have a conversation, because cybersecurity issues are so pervasive now, both, I'll say, locally to your individual institution, but also the network of third parties, that it's unavoidable. So you're going to be forced to have these questions, and you're going to be forced to have these events, and you have to be practiced in the questions you ask yourself so that you could reduce the risk of those as much as you can proactively.
Right.
There's no perfect solution, but supply chain is, third-party risk is probably one of the most significant and under-resourced risks hospitals have right now.
And I imagine it's hard to anticipate what a cyber attack will look like, because I imagine there's many different forms of attacks and threats. But when it comes to being proactive, how do you advise fellow hospital IT teams to get in front of issues? I know in cases like this, it's hard to not be more on the reactive side, especially when it's a third-party issue. But how do you go about being proactive?
The most important piece of advice is to remain engaged. There is nobody that I would say knows it all in healthcare cybersecurity. And if you run across somebody who says they know it all, I'm pretty sure they're wrong. So being engaged, both with your cohort and your colleagues, but the news of the day, right? It is a daily grind to keep up with what's going on.
Right.
And that's not just a CISO's job. That's your team's job. So we had an event with a vendor that we learned about yesterday, and I learned about it through a little bit of a roundabout way. But that doesn't mean it was a bad way of learning about it. So I would say be open, be receptive about wherever that engagement is coming from. But it's also a pretty good indication of how security conscious your IT department is, or where your major workloads are, right? So if you're getting a news article from, in my case, a faculty member from ophthalmology, right? Maybe it came out of the blue, but it is somebody that went out of their way to say, hey, I think this is important. And it's critical that you don't ignore it.
Right.
And that you sit and you read it, you understand it, you respond, and you engage in that conversation. Because security is a lot like patient safety. It's everybody's job.
Right.
The more you engage with it, the more willing you are to have that community of both formal and informal partners, the more you'll know. And that's most of the job. I mean, that really is most of the job, is building that community and that engagement and understanding all the inputs that resolve that which is you have to prioritize. And some days you get it wrong, some days you get it right. But one way to guarantee you'll get it wrong is to close yourself off from that news of the day, that engagement, that cohort. I would say it is probably impossible to be engaged and protect your institution without all those different inputs. And they come from all over the place, and you have to spend a lot of time doing it.
Yeah, and do you have to spend a lot of time and resources in educating people like myself, or outside of IT and outside of the digital space in that sense? Do you have to educate them on what a cyber attack looks like? I imagine that's a huge part of what you do, because it's really something that can infiltrate the system from many different angles. And it's not just the IT and cybersecurity team that needs to be aware of what a digital threat looks like.
It is an extraordinarily important component to everything we do. I'm probably biased because as an academic medical center, learning and education is core, right? So you're soaking in it, right? It's an expectation.
Right.
That you don't just put in a technical control that disrupts somebody's day without the meaningful reason why.
Mm-hmm.
But I'll also say most of security is about taking something away, right? We have to change the way you sign on to email. We have to change where you're saving your file. We have to change which vendors you can use. So a lot of times the CISO and the direction that she's putting in is bad news, right? It can be perceived as bad news. So it is critically important that with every change, you're communicating the why and you're engaging stakeholders to help inform how you do it.
Right.
It's if you just make arbitrary changes without any good meaning, you're probably making good security choices that are bad operational choices. And the only way you learn that is through that communication and education engagement. For as much as we have to teach about cybersecurity, our leaders have to teach CISOs about hospital operations or research operations or learning mission and those types of things. And so it's definitely a two-way street. And you have to be open and available to that. Otherwise, you will put in bad controls.
Yeah.
It may be great security controls that look great on an audit, but if you put in a boneheaded email control that makes it so inconvenient for people to use email, they just use Yahoo Mail, you haven't solved the problem.
Right.
You need to have that engagement. You need to have that calibration in that bilateral education. Because healthcare is really, really complicated, let alone academic medicine. Healthcare is really, really complicated, and every day is a learning experience.
Right, let alone healthcare, cybersecurity. So I want to ask a really important question about just understanding the devastating impact that this has had across the nation. I want to hear from you how lawmakers and those that work in our regulatory space, how can they support hospitals and health systems when they face these cybersecurity attacks? You mentioned earlier, some of them are fighting to keep their lights on when these things happen. So what can our lawmakers do to support?
I think this is a touchy space, and I probably have some stronger opinions that I deserve on the topic. In general, the types of regulations and statutes and administrative rules that I believe would be most helpful are the ones that improve the collective security of an interconnected sector. Healthcare is extraordinarily interconnected. So if there's legislation that is, here are these minimum cybersecurity requirements, and if you don't do them, you'll be financially punished, it's going to disenfranchise patient access, right? Because some companies don't have the ability to invest hundreds of thousands and millions of dollars into cybersecurity. They're making choices between switching out the air handlers in the hospital versus investing in a cybersecurity product. So that's almost an impossible choice. If you add regulatory penalties to the healthcare organizations, or if you penalize victims of cybersecurity crime, which often are healthcare companies, we're not leveraging the legislative angle to our benefit. And I see a mixture of those types of proposals where if a company is not investing in cybersecurity, it's almost assumed they're being negligent. And it's more detailed. It could be, but often it's these hard choices. So there needs to be a ramp up of those types of investments, a ramp up of those types of collaborations. And they need to happen across a sector, not just for an individual company. Because, as I mentioned, all healthcare is interconnected.
Right.
We live in a really large state with really rich counties and really poor counties. And by and large, really poor counties have patient access issues. They just aren't the facilities. So there should be a mechanism, there should be an incentive for the larger healthcare companies in service to the state to more freely collaborate around cybersecurity. And there is a specter of privacy and keeping quiet, right? That, as I mentioned, is getting better over the years, but it's still there.
Right.
And the level of engagement that is available isn't necessarily known to all. I think there's 83 counties in Michigan, all 83 counties.
Right.
And we need legislation, and we need statute, and we need leadership to help encourage that from all angles, because those resources are essential. And in my opinion, when there is punitive legislation, it causes people to isolate themselves and keep quiet. And that's the opposite behavior we need.
Right. And I appreciate you touching on the patient access piece because they've cited from this Change Healthcare incident that it's having the harshest toll on community health centers, which are the areas that are serving, vulnerable patient populations, people who are uninsured. So when they're not able to operate, then communities throughout the state and country are losing out on vital healthcare services.
Yeah, and if anything, cybersecurity should be a call for community hospitals to lean forward and look for those partners. Those partners are there. And anything we can do either through MHA or groups like the Michigan Healthcare Cybersecurity Council or through vendor partners like CyberForce Q, those partnerships are there. And I would encourage anybody to reach out and figure out how to engage.
Absolutely. Yeah. And I know you're really busy, but I do want to close out just with one last question that sounds like you even started to answer, but what steps would you uplift for hospital leadership to improve their digital security and lower risk?
I think one of the most important things any hospital or healthcare organization can do is start establishing a long-term framework for improvement. And there's a bunch of them out there. There's one that we're particularly favorable to called the NIST Cybersecurity Framework, which gives you a measurable way of approaching so that whatever investments you can make, whether those are cash or just policy, you can measure over time your improvement. This is incredibly important. If you do find yourself in a cybersecurity scenario, you can show it diligence, right? Because cybersecurity has a price, but there's no magic number of what to invest. There's benchmarks, but there's no magic number. You say, I just invest a little bit more and nobody knows cybersecurity. So the only way you can really chart if you're making progress is using one of these recognized frameworks. And they're reasonable. The NIST Cybersecurity Framework is recently updated. It's free. It's fairly human readable. And it's something that can persist through leadership changes. CIOs turn over, CEOs turn over, CISOs turn over, and you want a framework and a model that's going to persist regardless of who's accountable for it. And that's one of the most important things you can make time for.
Right.
It's an affirmative action. It is a proactivity that you need to focus on. It won't happen overnight, but that's one of the most important things you can do. If you're the second thing I would say is if you're a smaller company that doesn't have a large IT department or an information security department, plenty of hospitals don't have a CISO, is to look at what are the costs and implications of getting some professional cybersecurity leadership. There's virtual CISO programs, there's fractional CISO programs, there's managed security service providers, MSSPs, that we've mentioned, like CyberForce Q and some others that are nationally recognized. Figure out how to get that type of leadership support, even if it's just a little bit per year, because that'll be profoundly valuable. The good thing about cybersecurity is it's very teachable. And if you have that framework and you have the willingness to do it, you're going to see improvements. There'll be small improvements year over year, but you can be able to measure it and you'll be able to demonstrate that and be better prepared.
Absolutely. Jack, I want to thank you for being here. I've learned so much today, and I think our listeners have a lot to walk away with. I just appreciate your time so much.
Thank you. Thank you very much for having me.
With that, I want to thank our listeners for tuning in and encourage anyone interested in learning more about Michigan medicine to visit michiganmedicine.org. We're also going to link to more information about CyberForce Q and how to get in touch if you're interested in utilizing their industry-leading technologies to advance cybersecurity. Thanks for listening. We'll be back soon with another episode. Thanks for listening to the MiCare Champion Cast. To learn more or get involved, visit MHA.org.